Start. Welcome back guys. Now in this video, let's discuss about thyroid hormones. See, first of all, what you should know regarding the thyroid hormones. Thyroid hormones, are they peptide hormones? Are they amine hormones? Are they steroid hormones? See, thyroid hormones, first point number one, they are amino acid derived hormones, or you can say amine hormones. Amino acid derived hormones. Okay, they are from amino acid. Which amino acid? Tyrosine, derived from tyrosine amino acid. So these are amino acid derived hormones, but act like, thyroid hormones act like steroids. Okay, thyroid hormones acts like what? Steroids. Why I am saying acting like steroid, guys? Because see, thyroid hormones, even though they are amino acid derived hormones, they are acting like steroids because they can cross the cell membrane. So thyroid hormones are lipid soluble hormones. So thyroid hormones, I have told you, they act like steroids because they are lipid soluble. Okay, they are lipid soluble hormones. They can cross the cell membranes. Lipid soluble meaning they can cross the cell membranes and they can directly enter into the cell. Now, look at here guys. Let me show you a thyroid gland. Let's say here I am showing you a thyroid gland. Now, in the thyroid gland, you can see here these cells which I am showing. Okay. See, in the center there is a space and there are cells surrounding that space. Now, the central space which I am showing here, this is called as a colloid, and the cells which are surrounding this colloid, these cells, they are called as a follicular cells. Now, write guys here, these are follicular cells. Now, what these follicular cells are producing? So, these follicular cells, they are producing T3 and T4 thyroid hormones. Not only follicular cells, surrounding the follicular cells, there are also parafollicular cells. See, these cells which I am showing in the red color, these are called as the parafollicular cells. See, these parafollicular cells, right, parafollicular C cells. What do you think they produce? The parafollicular C cells, they produce calcitonin. Okay, so from today you should say thyroid gland is producing two types of hormones, the thyroid hormones T3, T4 and calcitonin. Now you might be thinking, sir, what exactly is this calcitonin doing to our body? Calcitonin function is to decrease our blood calcium levels. Calcitonin always decreases our blood calcium levels. Then what is that hormone which can increase my blood calcium levels? Which hormone increases the blood calcium levels? The answer will be parathyroid hormone. Parathyroid hormone increases the blood calcium levels and the calcitonin decreases the calcium levels. So they are antagonistic hormones. Parathyroid hormone is an antagonist of calcitonin. Now, how do you think the questions will show up in your exam? They will ask you to identify the histology image, which are follicular cells and which are parafollicular C cells. Now, look at here. In this diagram, you can very clearly see the central space is called as what? Colloid. And surrounding the colloid, what are these cells, guys? These are the follicular cells. These are the follicular cells. And here, these are the parafollicular C cells which do not have any colloid. If you look the same in the real histology image, you can very clearly see these are the thyroid follicles. These are all the thyroid follicles. And these thyroid follicles, they are all surrounded by these blue color cells. So what are these blue color cells which are surrounding the colloid? These are follicular cells. All these are the follicular cells. But if I am talking about a parafollicular C cell, it does not have any colloid. You can see here, for example, these cells, okay, in this area which I am highlighting. So these cells, they do not have any colloid. These are parafollicular C cells. Okay, the parafollicular C cells produces calcitonin. Okay, now again all the important points, revising one more time. See, thyroid hormones, they are amino acid derived hormones derived of tyrosine amino acid. Thyroid hormones, even though they are amino acid derived hormones, but act like steroid. Why? Because they are lipid soluble hormones, so they can cross the cell membrane and they can enter into the cell. Okay, they can enter into the cell, they cross the cell membranes. And these are the only lipid soluble hormones that can be stored for months. Usually, what are the examples of lipid soluble hormones? In the basics I have taught you, the two lipid soluble hormones are thyroid hormones and steroid hormones. Okay, thyroid hormones and steroid hormones are lipid soluble. So lipid soluble hormones are never stored, guys. They are never stored. They are produced and used up. Whenever there is a need, they are produced and used up. But the only lipid soluble hormone which can be stored even up to 2 to 3 months is thyroid hormones. Yeah, they are lipid soluble and they can be stored. And I have taught you, right, they can cross the cell membranes. So the thyroid hormone receptor, the receptor for the thyroid hormone, is it present on the cell surface? No, it is entering into the cell. So definitely thyroid hormones are having intracellular receptor, but where? In the nucleus, not in the cytoplasm. So the thyroid hormones have intranuclear receptors. I gave you already the mnemonic in the basics. So what are the hormones which are having intranuclear receptors? The mnemonic which I gave you, sex with T3, T4. So sex hormones like estrogen, vitamin A and vitamin D, and thyroid hormones T3, T4, they are all having intranuclear receptors, not the cell surface receptors or not the cytoplasmic receptors. Okay, done. Now after discussing this, let's see how the thyroid hormones are produced, the production of the thyroid hormone. Okay, how thyroid hormone is produced. Now, it's very important, guys, especially for you to understand pharmacology and how to treat the hypothyroidism and hyperthyroidism. This is very important. Okay, what are the steps involved? Let's say these are the thyroid follicles. You know, these are the thyroid follicles, the follicular cells. In the center, what is this, guys? Colloid. Now, I am taking this area. Okay, I am talking about this area where I am taking one follicular cell and a bit of colloid. So, you can very clearly see here this is the follicular cell and here there is colloid. Okay, the central space colloid. Now, in this story, let's say there is a hero and there is a heroine in our topic. Now, who is the hero? Let's say today you are eating a seafood. Okay, seafood which is rich in iodides. So, today you got iodides in your blood. Now, we all know iodides are needed for the production of thyroid hormones. Okay, iodides are needed. Now, this iodide, once it is there in the blood, it will definitely go to the thyroid gland. And now, see these follicular cells, they are having a transporter. You can very clearly see there is a transporter. So, this transporter, it is helping in the absorption of this iodide. See, the iodide came into the cell. Okay, the iodide came into the cell. Now, what is the name of this transporter? See, this transporter is called as a sodium-iodide symporter. Along with iodide, even sodium is also getting absorbed. So, what I am trying to say, the transporter which is helping in this iodine trapping, what is the name of this transporter called as? Sodium-iodide symporter, or you can say sodium-iodide cotransporter. Okay. So, here is our hero. Hero came into the cell. Now, what about our heroine, sir? See, hero should have to go and meet our heroine, right? See, these follicular cells, the follicular cells, they are producing, see the rough endoplasmic reticulum of the follicular cells. It's producing a protein called as thyroglobulin. So, this thyroglobulin which I am marking here, okay, she is our heroine. Now, where is our heroine going? See, the thyroglobulin, she is coming into the colloid. She is coming into the colloid. I have taught you, right? Thyroglobulin is a protein. Proteins are made up of amino acids. So, these are the amino acids. Okay, these pink color things, these are the amino acids. Which amino acids are? Tyrosine amino acid. Okay, tyrosine amino acid, thyroglobulin made up of tyrosine amino acid. Okay, so here what I am showing you, this is the structure of our thyroglobulin with tyrosine amino acid. These pink color things are tyrosine amino acids. Fine. Now tell me, where our iodide came? Iodide, now he came into the cell. Tell me, will he be happy or not? No, definitely he is not happy because he came in search of our thyroglobulin. But our thyroglobulin is not there in the cell. Okay, she is not there. So, our hero, iodide, now he is going in search of our thyroglobulin, our heroine. So, now this iodide, it is coming out of the follicular cell, it is entering into colloid with the help of a transporter called as a pendrin. Okay, now tell me, our hero entry into the cell with the help of the sodium iodide symporter and exit out of the cell with the help of a transporter called as a pendrin. Entry, exit. So, now tell me, finally, our iodide came into the colloid. So, he is very happy. He is looking at the thyroglobulin and he is very much excited. Okay. But the twist in this story is the thyroglobulin, our heroine, the thyroglobulin is not liking our hero. She is not liking him. Okay. She is saying, I don't like him. Why? Because our hero is a negative fellow. Okay. He is I minus. He is a toxic guy. Okay. So, do you think our ideal heroine, our ideal girl, good girl, do you think she will like this toxic guy? Definitely no, right? So, now he is not happy now. He is not happy because he is not getting accepted. Now, what happens? There is a friend called as thyroid peroxidase. See, this is an enzyme. Thyroid peroxidase is an enzyme. It's like a good friend. Now, what this thyroid peroxidase is doing? This thyroid peroxidase, he is coming and talking to our iodide. You are so toxic. You are so negative. You are having a lot of negativity. So, you need to change yourself. So, you should become like a good guy so that she will like you. Now, this thyroid peroxidase, what it is doing? It is converting our iodide I minus into I2, that is iodine. the iodide is converted into iodine. So this process is called as what? Oxidation. Okay. Now tell me, what is the enzyme that is helping in the process of oxidation? Thyroid peroxidase. So now tell me, we are having a good hero. Okay, I2. Now he is so shy now. Okay, being a good guy, he is so shy. Okay, he is now good, but he is so shy. Okay, he is not having guts to go and meet with our thyroglobulin. Okay, because he is already rejected once. Okay, he is not daring to go and meet with the thyroglobulin. So again, the same friend is helping. The thyroid peroxidase TPO is helping. Now what this TPO is doing? Now this TPO is taking the iodine. Now it is taking the iodine and attaching this iodine. See, attaching this iodine to the thyroglobulin, which means for the first time, our hero heroine, they met with each other. Means like they are going on a date. Okay, they are going for a coffee. Okay, for the first time, they are meeting with each other. So this process is called as organification. So what exactly is this organification of iodine, guys? Organification of iodine means the iodine, which is inorganic. Okay, inorganic compound, right? Iodine is inorganic. So the iodine is getting incorporated onto a protein called as a thyroglobulin, which is organic thing. Okay, proteins are organic. So that's why this process is called as organification of iodine. Now you tell me, when both of them met with each other, okay, what happened? What is the resultant thing? Okay, the resultant thing, now look at here. On this tyrosine, how many iodines are sitting? 2 iodines are sitting. So this molecule is called as a diiodotyrosine. Here also same thing, 2 iodines are there, so diiodotyrosine. Here also same thing, 2 iodines are sitting, so diiodotyrosine. But concentrate here, on this tyrosine, only 1 iodine is there. So this is called as a monoiodotyrosine. So now tell me, because of this organification, how many molecules are producing? There is a production of either DIT molecules or MIT molecules. Okay, done, fine. Now, what is the last step? So they met with each other, they went for a coffee, the date was successful, they liked each other. So what is the next thing that's going to happen between them? Now, once 2 people like each other, what they are going to do? They have to become a couple. Okay, the last reaction is called as a coupling reaction. In coupling reaction, what happens is the DIT molecules, if 2 DIT molecules fuses with each other, it will form T4. If a DIT molecule fuses with an MIT molecule, it produces T3. So even this coupling reaction is mediated by the same friend, same enzyme, thyroid peroxidase. So can I say something like this? The oxidation, organification and coupling reaction all are mediated by the same enzyme called as a thyroid peroxidase. So now tell me, what exactly is oxidation, guys? Oxidation is the conversion of the I- into I2. Okay. What is organification? Organification is the binding of the iodine. It's a binding of the iodine to the tyrosine. That is organification. And what exactly is the coupling? Coupling reaction. In coupling reaction, the DIT molecules fuses with the DIT molecules, or either a DIT molecule can fuse with an MIT molecule, resulting in the formation of T4 and T3. So these are the resultant products, or you can say once they become couple, these are the babies. Okay, this is how T3, T4 are produced. So now let's see the steps one by one. Guys, what is the first step? Uptake of iodide, that's the iodine trapping with the help of which transporter? Sodium iodide symporter, you know it. Now the sodium iodide symporter, it can be inhibited. It can be inhibited by certain agents like perchlorates and thiocyanates. Okay, so these are like poisons, let's say. These perchlorates and thiocyanates, what they will do? They can inhibit the sodium iodide symporter. Now question is, sir, where exactly is the sodium iodide symporter present in our body? Sodium iodide symporter, do you think it's only present in the thyroid gland? Yes, of course it is present in the thyroid gland. It's present on the follicular cells. But it is also present in some other areas, right? These sodium iodide symporter, they are present on the follicular cells of the thyroid gland. But not only that, salivary glands, especially parotid, salivary glands, mammary glands, placenta, gastric mucosa, choroid plexus, okay, ciliary body, etc. Okay, these are the important things which I want you to know. Placenta was recently tested. So sodium iodide symporter is not only present on the salivary glands, follicular cells and mammary glands, It's also present in other areas also. It's also present in different areas of the body. Okay, you have to by heart this. Next, okay, iodine completed. Next, what about the next step? It's a synthesis and the secretion. Synthesis means production and secretion of thyroglobulin, our heroine. So it's the production and secretion of thyroglobulin into where? Into colloid. Okay, into the colloid. Our heroine is waiting in the colloid. Next, what are the three important steps, guys? First one is the oxidation. Next one is organification, and last reaction is coupling reaction. In oxidation, the I minus, okay, iodide I minus is converted into iodine I2. In organification, what is happening? In organification, our iodine, it is going and incorporated onto the tyrosine, resulting in the formation of DIT molecules and MIT molecules. Already I have explained you this. And what exactly is happening in the last reaction? That's a coupling reaction. If a DIT molecule, diiodotyrosine, fuses with the other diiodotyrosine, di plus di, it's going to be 4. It's going to form T4, which is called as thyroxine. If a DIT molecule, if it fuses with the MIT molecule, it forms T3, that is triiodothyronine or triiodotyrosine, you can say. Okay, so this is how T4 and T3 are produced. Now, finally, I can say oxidation, organification, coupling reaction, all are catalyzed by the one enzyme that is called as the thyroid peroxidase. Now, having said that, you might be thinking why you should know this. It's because, see, there are certain drugs like propyl thiouracil, carbimazole, methimazole. These drugs, they can inhibit thyroid peroxidase. They can inhibit which enzyme? Thyroid peroxidase. So, if thyroid peroxidase is not working, do you think you can produce T3-T4? No, you can't produce T3-T4. So these drugs, propyl thiouracil, carbimazole, methimazole, they are anti-thyroid medications. They can be used in the treatment of hyperthyroidism. They can decrease the T3-T4 hormone production. Okay. So look here, propyl thiouracil, P for P. Propyl thiouracil, it's a drug of choice for hyperthyroidism in the pregnancy. Which trimester? Especially first trimester of the pregnancy, and it is also used during the lactation. So during the time of the lactation as well as the first trimester of the pregnancy, propyl thiouracil is the drug of choice, and carbimazole, methimazole, that the drug of choice for same hyperthyroidism, but during second and third trimester of the pregnancy. Okay, and it is also the drug of choice for Graves' disease also, because Graves' disease is nothing but hyperthyroidism condition. So what I am trying to say, it's a carbimazole, methimazole, and propyl thiouracil, they are the inhibitors of thyroid peroxidase. They are anti-thyroid medications. They can be used in the treatment of hypothyroidism. Okay. Now, let me explain you what is Wolff-Chaikoff effect. Okay, what is the Wolff-Chaikoff effect? See, high levels of iodine intake. What will happen? Usually student will think, sir, iodine helps in the thyroid hormone production. I am taking iodine, it helps in the thyroid hormone production. If I take more amount of iodine, do you think more amount of T3-T4 is produced? No, actually not. Reverse is going to happen. Taking high levels of iodine actually decreases the T3-T4 hormone production. Even though you take high amounts of iodine accidentally, you will never land up in hyperthyroidism. Actually, you will go into hypothyroidism. Why? Because high levels of iodine, what it will do? Inhibits thyroid peroxidase. The thyroid peroxidase enzyme is actually inhibited because of high levels of iodine. Especially organification step will be inhibited. So what happened to T3-T4 hormone production? Decreases. So this effect is called as Wolff-Chaikoff effect. Okay, let me give you an analogy. See, you guys are doctors. Okay, in the future you guys will be doctors. So you are getting your salary. You are working in a private hospital. You are working and you are getting your salary. Of course, you are doing the social service. Okay, but at the end of the day, you have to get your salary. No. So you are getting your salary and you are working. So every month you are getting your salary. You are working. But imagine one fine day you got a lottery. You got a $1 billion check. Let's say. See, $1 billion is not a small amount. It's like almost an economy of an entire country. So $1 billion. So if you get $1 billion, will you be practicing? Still practicing? No. You will stop working, right? So when you get a lot of money, you will stop working. In the same way, when you get a lot of iodine at a time, the thyroid gland also stops working. That is called as a Wolff-Chaikoff effect. Okay. So with this successfully what we have completed? We have completed the topic of the basics of thyroid hormone and how thyroid hormones are produced. Hope the video is helpful. In the next video, we'll be discussing about what are the differences between T3 and T4. We'll discuss about the peripheral conversion. We'll discuss about the thyroid storm and what are the actions of the thyroid hormones. Okay. Hope the video is helpful. Thank you again.